It's difficult to go to a reproductive medicine specialist. It's difficult to understand that why I'm not able to conceive. It's difficult to realize that we have been trying for so many days, but it's not working. What is wrong? Is something wrong in me? Is it wrong with my partner? So a warm namaste to all of you. So here we are discussing a series of questions which a reproductive medicine would definitely ask you if you go to her or him. And when a doctor shoots you with so many questions, you get frustrated as to why she's wasting her time and why she's asking me all this. It's not related to me. So here I am to tell all of you that each simple question gives us a lot of information. So how are you doing? And hopefully you might have watched my previous video which explained something about the role of occupation, the role of years of married life, the role of use of contraception, and a very important role of age. So now further going on this series, I would again tell you what are the other questions which we discuss with the couple when they come to us. Do you suffer from any issues? We ask you history of having a thyroid disorder, or we ask you about if you have any history of hypertension. We ask you history of diabetes, if you are suffering from that. We ask you if you have suffered with any history of tuberculosis in the past, because again, it has been shown in my previous videos that when we asked you about tuberculosis, it's very important for us because tuberculosis has got a very important role in the reproductive system. Again, when we ask about diabetes and hypertension, it is important for us to manage that before we plan any kind of ART treatment with you. And also, once you conceive after the ART treatment, the management for diabetes in pregnancy, for having hypertension in pregnancy after ART treatment is entirely different. Thyroid disorders are very easily managed. You have to take some pills for thyroid and there shall be no issues with pregnancy if at all we have come to know about this disease beforehand. We also measure your prolactin levels when you come to us, and these prolactin levels tell us a lot of things about you. If the prolactin levels are increased, you might have ovulatory disorders, you might have abnormal eggs, you might not have good quality oocytes. So again, managing all these medical disorders before taking the treatment ahead for ART is very important. So thank you so much. Here is some little more information about the history which the doctor asks you when you enter a fertility clinic. We will discuss further on this later in our next videos. Thank you so much for hearing me patiently.